Hi everyone. So we've been using the ketogenic diet and other metabolic therapies as a means of treating my schizoaffective disorder over the last 2 months or so. And we've kind of been taking you along on this journey or this project of using these interventions as a treatment for my mental illness. But something that's arisen as feedback from a lot of our audience is a certain degree of skepticism around this being kind of a new branch of science in the treatment of psychiatric disorders. And so we're going to have Dr. Bret Scher back with us today to talk with us more about what research has been done or what current research is going on around the connection between keto or metabolic therapies and mental illness. Dr. Bret Scher is a metabolic health specialist, and he is also the director of Metabolic Mind. Metabolic Mind is a nonprofit working to transform the study and treatment of mental disorders by exploring the connection between metabolism and brain health. They have a really wonderful YouTube channel also called Metabolic Mind, which we'll link to in the description below, where Dr. Bret Scher is also the host of, where they dive into a multitude of topics as well as research and current studies being done around this area. So hello everyone, I'm back with Dr. Bret Scher again, who's joining me today to speak to what kind of research has been done around the ketogenic diet and using it to treat mental illness, and what kind of research is ongoing. So thank you so much for joining us again, Dr. Scher.
Oh, my pleasure. Thanks for having me back.
So we've been hearing from a lot of people that there's a great deal of skepticism and feeling of there being kind of a lack of empirical data or research backing the claims that the ketogenic diet or metabolic therapies can be effective in the treatment of mental illness. Yeah. I've done some digging into studies that are going on, and I think that there is actually a lot more that has been done and is going on than people may realize. And so as director and host of Metabolic Mind, you have access to a lot of the clinicians and researchers who are doing a lot of work in this area. And so I was hoping that you would be able to share with us some of the current research that's being done or has been done around this link or this connection between treating mental illness and the ketogenic diet or metabolic therapies.
Yeah, it's such an important topic, so I'm so glad you're addressing it. And I get it, because especially physicians feel the same way, because we're used to these large studies of thousands of people studying, a drug. Half of them take it, half of them don't, and you see the effect. And it's these large randomized controlled trials, and that doesn't exist for the majority of any nutritional intervention. That doesn't exist, but specifically for ketosis for treating mental illness, that does not exist. So if that's your threshold for evidence, then yeah, we don't have that. But there's so many other layers of evidence that exist to suggest that this is something that's worth exploring and potentially worth trying with clinical supervision. And the interesting thing is it actually can go back. You could say it could go back 100 years in terms of clinical experience of using ketosis as a therapeutic intervention for seizures. But then over the past couple of decades, we actually do have randomized controlled trials showing ketogenic therapy is effective for treating seizures. So, okay, the skeptics are saying, well, you're talking about seizures. I want to know about treating mental illness. But, the point is we know it's effective, safe and effective for treating brain-based conditions. Now, it turns out a lot of the medications we use to treat seizures are the same we use to treat certain psychiatric diagnoses, and a lot of the mechanisms are thought to be similar. So it would make sense that a dietary intervention for one could treat a dietary intervention for another. So again, that's not a randomized controlled trial, but that's the start of an evidence basis to say, maybe there's a connection here. So then next we have lots of anecdotal reports and clinical experience showing that it is effective in a number of people. Again, not randomized controlled trial, but this is how science starts. Any new field, any novel therapy starts in this manner. It doesn't start with the large randomized controlled trials. Well, fortunately, we now have a number of different pilot trials that have been completed, not published yet, but have been presented at scientific meetings, largely funded by Bazooki Brain Research Fund, that have shown, that have demonstrated, again, safe and effective interventions of ketosis for treating mental illness. Now, I don't want to stand here and say we have definitive proof that this should be first-line therapy in everybody. Like, absolutely not. We have so much more we still need to learn about, and research will hopefully start to show this. In fact, we just did a a video at Metabolic Mind highlighting a new trial starting at McLean Hospital, which is a randomized controlled trial of a ketogenic intervention on top of standard therapy for bipolar disorder for 12 weeks to see what the effects are. I'm really excited to see the results of these trials, but more excited just to acknowledge that these trials are happening. And this is the progression of research, of science, as we're learning more. So if somebody said, I'm not starting this until there is definitive proof that ketogenic therapy is effective for treating mental illness, then we're not there yet. But if you said, I'm looking for a therapy that is different, that can help me with my side effects, that can help me achieve greater quality of life, and that is likely safe and effective, I'd say ketogenic therapy is there when done with proper supervision with clinical guidance, right? So it depends on where your personal threshold is for saying what is the scientific evidence. But we have to acknowledge that emerging fields have emerging levels of evidence.
Yeah. So I think that it's a really big shift that we're asking for an entire medical community to get on board with. And that's going to take a lot of time. And that's going to take, those big randomized control trials that you were discussing that are in the works. Are those starting to happen? The more randomized control trial?
Yes. This one that I mentioned at McLean is starting to enroll now. So,
okay.
It's underway.
Yeah. But I think, that's kind of why I got excited about this, is seeing the preliminary pilot studies that are being done. And we can link to some of those in the description below. But, seeing that we're on the cusp of some sort of change. And so I think that felt really exciting to me. And that's why I wanted to dive in more. But yeah, it's exciting to know that there are those larger studies done that are going to be more pivotal in terms of shifting the status quo, I guess, if you will, in the medical community or in the psychiatric community. I guess it doesn't quite make sense to me that, there's conclusive data on keto as a treatment for epilepsy. And so it strikes me as, why isn't there more impetus to look at diet and its effect on other neurological conditions if it's such an effective treatment for that? So can you speak to that at all? Why there hasn't been more of a movement to study that further, or more of an openness or willingness to study that further?
Well, I think two things. One, just nutrition in general is harder to study. It is definitely more challenging. And you don't get the big funding sources, right? If you're studying a pill, there's a drug maker who has vested interest in that pill becoming, all over the world, the first line therapy. So they're going to put millions and millions and millions of dollars behind it. Same doesn't exist for food. It's just food, right? So that's one detriment right off the bat, and it's harder to control, and it's harder to do long term. So people don't study nutrition as much. But then if you're talking about ketogenic nutrition, that adds another barrier because of sort of as we talked about in our last interview, that I guess there's a bias or inherent concern about all that fat, not realizing that ketosis is a unique physiologic state and the evidence that supposedly exists for fat being harmful doesn't necessarily apply when you're talking about a ketogenic diet and ketogenic therapy. So there's also that extra hurdle to get over. So there are barriers to nutrition in general, and then a barrier to ketogenic nutrition. So I think that's why it's not being studied quite as much. But that being said, there are still some really encouraging signs. Like there have been studies using ketogenic therapy in cognitive impairment or early Alzheimer's, or even in Parkinson's disease. There are some studies that have looked at this now early, but they've shown beneficial effects. And the same is now being seen for mental illness. So it's clear we're just kind of at the tip of the iceberg now, and we're going to start to see it expand more and more studies coming about, which is going to be really exciting for this whole field. Because, let's face it, these areas that I mentioned, whether it's serious mental illness, whether it's Alzheimer's and cognitive decline or Parkinson's, our treatments are not great, right? They can be acutely helpful, they can be acutely life-saving, but for the long-term quality of life, in general, compared to other medical fields, it kind of lags behind. So it's an area that is ready for improvements.
Right. So The research on connecting, treatment of medical keto for mental illness and whatnot is kind of on the cusp of getting started. But is there much research on metabolic therapies or even the connection between metabolic health and mental illness?
Yeah, so the connection between metabolic health and mental illness, there are a number of association studies that clearly show if you have metabolic dysfunction, you are more likely to develop some sort of psychiatric diagnosis, whether it's depression, bipolar disorder, schizophrenia, and vice versa. If you already have a mental health disorder, you are more likely to then develop or have metabolic dysfunction. Now, some of that is a function of the medications, of course, but it goes much beyond the medications in general. So there is this definite connection. And then you have this fascinating research by Dr. Cindy Calkin. And what she did was she took people in her practice who had treatment-resistant bipolar depression, and she treated half of them with metformin. So metformin is a medication usually used for type 2 diabetes, and it's an insulin sensitizer. It can help with insulin resistance. Not a psychoactive medication. It isn't known to have any brain effects. So it treats systemic insulin resistance. And what she found was 100% of the people who got metformin and improved their insulin resistance also dramatically improved their bipolar depression scores. So that's not using diet, using a medication, showing if you find people who are insulin resistant and treatment resistant, and you fix that insulin resistance, not with a brain-based drug, but with a liver-based drug, you improve their psychiatric symptoms. So that's a pretty powerful study to say, wow, okay, there's definitely something there with this connection between metabolic and mental health. So yes, I would answer your question with a big yes, that there is evidence showing that connection and the importance of that connection.
Right. Yeah. And I think that is, just establishing a basis for that connection is a great jumping off ground to establish more metabolic therapies like the keto diet as an effective treatment tool for mental illness. So I'm excited to see where the research is going and what is going to come next. So
yeah,
thank you. But
there's more to it too, right? So just like this one study used metformin, and we're talking about ketogenic diets. And as you're, showing through your journey, there's also sleep. There's also, exercise. There are other metabolic therapies that can contribute. So anything that's going to improve your metabolic health is likely going to have that beneficial mental health impact. So ketogenic diet tends to be probably the most powerful of them because it completely changes your physiology, but that doesn't diminish the importance of sleep and exercise and stress management and avoiding toxins and all these other things that are going to improve your metabolic health.
Right. And I think that I, among many other people, overlooked kind of lifestyle factors or what are seen as lifestyle factors like that as, effective medical interventions. And so, it's helpful to see research and whatnot being done about why these are really of benefit and effective in terms of managing things like mental illness as well. All right. Well, thank you so much, Dr. Scher, for chatting more with us about current research that's being done or research that has been done around the link between metabolic health, the keto diet, and treating mental illness. It was great to hear from you.
Yeah, my pleasure. So great to be on again. Thank you.
So thank you so much to Dr. Bret Scher for joining us again to discuss further the current landscape of research that's being done around the connection between keto and metabolic therapies as well as mental illness. We will provide links to some of the studies that Dr. Scher mentioned, as well as other studies we may think are relevant for you to check out. Also, just a reminder to check out the Metabolic Mind YouTube channel where they explore these topics and more even further. Thank you so much for watching, and as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.